yet. Okay. Got it. All right, welcome everybody. Nice to see everyone. We don't have a quorum yet. People will be joining us, so I'll postpone a couple of things. Lori, do you think that, let's see, I'm trying to figure out, Olivia's not on yet. Sandy, do you want to give us your update first? I know it's really busy for you, so I appreciate your being here. Absolutely.
Okay, I sent you a copy of good afternoon, everybody. Sandy Damiano, Interim Director for Health Services. I sent Farla and Libby a copy of the Adult Correctional Health Report. I don't know if we want to go over that or if you want to just send that out.
It was sent out.
It was sent out. Okay. Yeah. Nothing much remarkable on it. The one thing I wanted to comment on is that we have a lot of vacancies. That has to do with the board approval in June of vacancy of new positions for adult correctional health. Both adult correctional health as well as behavioral health are having a very large workforce shortage. So as I discussed at prior meeting, we worked with labor groups to make some economic package changes, and there have been behavioral health fair as well as an adult correctional health fair that happened in September, so really recently. So we're looking at the results of those. So hopefully some of those vacancies will go down for all of those programs. We need those positions to roll out existing services as well as to help with new initiatives.
Mm-hmm.
So I don't know if there's anything in particular you wanted me to comment on, Farla or Libby, on the adult correctional health report. I think the most remarkable, you had just gone to one of the slides, is our census has gone back up.
Yes.
You could see the yellow in 22, 23, where the average daily population is back up higher again.
Yeah, did see that. Yeah, that's so disappointing.
It's very difficult, very challenging.
Especially, yeah, well, that was one thing. And there's no reason for that you can see just creeping up.
Well, part of it has to do with, I think bookings are back up a bit. Length of stay is problematic. We mostly have felonies in the jails. So I think that's part of what's happening that you'll see.
Okay.
Okay.
What a challenge, especially with all the vacancies. Is there anything else in terms of recruitment that's in the plan? I know that there was a good response to the recruitment fair, but you have so many vacancies.
Yeah, we have over 100 in behavioral health division, as well as 50 or 60 in adult correctional health alone. So it is hard because there are workforce challenges across the service sector. That goes for the hospital systems, it goes for mental health, it's across the board. So we have done work extensively with Department of Personnel Services to help with recruitment. We will see in the next several months how that works for our licensed staff. And we'll take other steps in those areas.
Okay. So are there any other questions for Dr. Damiano?
And I have a few other announcements when we're done with that. Okay, cool.
I just want to let everybody know that our chat is not working. We're not permitted to put it on, actually. So if you have questions, please raise your hand. Yeah, Jofel, there you go.
Hi, sorry, not actually a question. I was just a couple minutes late, but just wanted to say I'm here. Thank you.
Thank you. Thank you. Thank you, Jofel.
I can do a few other quick announcements if that's okay.
Yeah, absolutely.
Okay, so I know that some of you may have attended or watched the board hearing on the Maze consent, which was extremely long. It was like 5.5 hours. That was in September. They are looking at having a board hearing where they're looking at staff recommendations in December. That hasn't been scheduled yet. It will be twofold. One is looking at facility recommendations, and the second part is on staff recommendations for reducing the jail population. So we will do both of those things. Will come as recommendations before the board in December. And we'll make sure PHAB and the work group get those announcements for when that hearing is.
Excellent. Thank you very much.
Yeah, and then the deputy director for primary health still interviewing. It's going exceedingly too slow. So don't have an appointment used for that. And they're in the final phases of the department head recruitment. So should have announcement for that shortly. So happy about that.
That's excellent. Yes. And I think there'll be an excellent person filling that position.
Yes.
Since I was on the interview board. Okay. I'm very pleased about that. Thank you so much.
You're welcome.
Any other questions? I don't see any. Okay. We have a quorum, so I will go back to, actually, I'd like to introduce our newest member. Welcome to George Meyer. We're very thrilled to have him on the board. George, would you like to just say hello? There we go. Hi.
Hello, everyone. I spent 23 years in the Air Force before moving here 25 years or so ago. And so some of the Air Force stuff I did was public health related. I'm mostly a gastroenterologist and volunteer at the student run clinics and the county clinic, and spent about 2.5 years on Monday mornings answering the phones at the public health office, answering crazy questions by people about COVID. Thank you for your invitation to join.
Thank you for your previous service to the county. I know COVID was very challenging, and I know that your work with the county at the time must have been incredibly. The county was incredibly grateful for that. And so I think in the interest of time, perhaps people can just introduce themselves very quickly. To George, I am Sarah. I'm an epidemiologist, and let's see, if I call on people, maybe you can just either introduce yourself and turn on your camera, or if you can't, just introduce yourself. So, Chase.
Yeah, hi, my name is Chase. I am a nurse over at UC Davis. I do nursing administration, and we're happy to have you. Thanks for being here.
Thank you. Phil?
Hi, my name is Phil Summers. I'm an emergency and addiction physician, and on the executive committee and the jail health committee for PHAB, and excited to have you.
And Phil is on our executive committee, yes. And Sanal? Thank you, Phil.
Hi, I'm Sanal. I work for the state on the public health department's budget. And I'm also on the executive committee and work with Farla on youth mental health issues. Very nice to meet you.
Thank you. Sarah?
Sure. Hi, everybody. My name is Sarah Bowski. I am a director of health for an international organization called Palladium, and have been working primarily in infectious disease, also a public health nurse.
Thank you. Barbie?
Hi, my name's Barbie Law. I'm sorry I don't have camera access today. I'm sitting on the PHAB in a public seat. I am a firefighter paramedic. I'm currently the fire marshal for the Sacramento Metropolitan Fire District, and I'm also representing PHAB on the Health and Human Services Coordinating Council.
Great, thank you. Libby?
Hey everyone, apologies for not being on video. I work predominantly in global health, have a background in workforce development. I'm also on the executive committee, co-chair the Correctional Health Working Group with Phil, and recently joined the advisory committee to the Public Safety and Justice Agency to try to connect the dots. Thanks.
Thank you, everyone. I really appreciate it. Okay, we'll continue on. We're going to just approve the minutes. So everybody's seen, I hope, a copy of the September meeting minutes. And are there any edits to the minutes? Seeing none, is there a motion to accept?
So moved. This is Steve.
Steve, thank you.
Second, Joe Phil.
Thank you, Joe Phil. Could you please just raise your hand with reactions if you approve the minutes, or you could, if you're on camera, also just raise your hand and we'll see. 1, 2, 3, 4, 5. Okay. I think that's minutes approved. Any nay? Anybody who doesn't approve the minutes? Speak up. No. Okay. All right. Thank you. Minutes approved. Next on the agenda. So, Dr. Kassirier, would you like to give the public health update now?
Sure. Good afternoon, everyone. So with COVID-19, the numbers do continue to go down. We just got our update for this week. The new case rate is at 7.2 per 100,000. The state recently did rescind or modify a number of state health officer orders. So basically taking away the requirement for surveillance testing for some work sites. And then also modified the masking mandate, where now it is in alignment with the CDC community transmission level. So Sacramento right now is in the low transmission level. So that means that for most people, masking is voluntary. Although the CDC also updated guidance for healthcare settings in California, CDPH still requires that there be universal masking in healthcare settings. But otherwise, for all others in Sacramento now in the low transmission level, it's voluntary, except of course for individuals with factors that put them at risk. With monkeypox, the numbers have also slowed down quite a bit. At the height of the outbreak, we were getting up to 22 cases added per week. That has gone down. Now we're getting about 3 to 4 additional cases. We have also seen a reduction in the demand for vaccination. We have reached out to the state to find out if we can expand the criteria. We've been able to expand it a little bit in terms of being able to, in addition to individuals in the MSM community, also include individuals that are affiliated with that community or engage in behavior that puts them at risk. I don't know that there will be any additional expansion of the criteria. And George introduced himself. I just wanted to say how appreciative public health is of the volunteers that helped us with the phones. At one time, we were getting flooded with phone calls. And as George indicated, some of them were kind of interesting. or stressful also. And so having volunteers that were able to help with answering those calls helped us a lot in making sure that we were able to focus on the case investigations. Lastly, just want to highlight that next week on Tuesday, we have our opioid summit. I don't know if Lori was planning to say anything about that. And Lori, I don't know if it's still open for registration, but it's the opioid epidemic continues. And actually, we did see an increase in cases, in deaths, even during the height of the COVID pandemic. And recently CDPH did send out a warning about a new type of fentanyl pill called rainbow pills that have very attractive colors and geared towards attracting young people. So there's been outreach to schools, and actually some of the schools have gone ahead and started offering education and even naloxone in some of their setting, the schools. And so a lot of education for us. I think it's very difficult for parents because you want to think that schools should be safe, but unfortunately, this is an area of risk. And no child is spared. It's not only for children that maybe are at risk or are in trouble. We've seen it with high-performing students in sports. And so I think it's important for us to take this seriously and find ways of actually being able to curb this epidemic, which right now we have not been able to. So I don't know, Lori, if you wanted to add anything about the summit for next week.
Yeah, if you was your report concluded, Dr.
Yes.
Kasserier? Okay. Yeah, I'll go ahead and just add a little bit more. We're at about 350 registered attendees for the summit. Again, there's going to be free food, lots of great resources, maybe not free Narcan. I'm not sure if registration has closed, but I believe it may have because I know they're doing the last minute ordering for that, but very excited about that summit. I wanted to also talk about the fentanyl campaign, the partnership between the Sacramento County District Attorney's Office and the Department of Health Services, Substance Use Prevention and Treatment. So we do continue our fentanyl campaign and going into the schools like Dr. Kasserier mentioned. So the Department of Health Services has contracted with an organization called Arrive Alive, and they're the ones who are actually doing the education and awareness in the schools. And so we've actually started, we started with Pleasant Grove High School, and there was 27 kids in attendance. And we started, last night was a parent meeting at Rio Americano High School in preparation for the assembly on October 18th for that high school. And I believe 1,600 students will be in attendance there. So the way we're doing this is we're meeting with the parents first, because there was some concern by the parents about Narcan distribution within the schools and not really understanding the benefits of it and understanding the fentanyl crisis in general. So we're starting with the parents, and then we're going to continue these assemblies in many junior high and high schools across Sacramento County. So continuing to address this crisis. Next, I want to do a follow-up to this board on the overdose mapping project that a presentation was provided to you, I believe the last meeting or the one before. And so very happy to report that Public Health and Substance Use Prevention and Treatment have partnered and being able to have access to the OD map system. And I wanted to provide a little bit of preliminary data for you all. So in the month of September, we had 164 reported suspected overdoses. And of those, 79 had naloxone administered. There was 24 fatal non-naloxone administered deaths and 61 non-fatal. So already we're getting some pretty good data from that. I would like to see some data kind of like where are we seeing these overdoses across Sacramento County so that we can really look at tailoring our prevention and treatment services there, but more to come on that update for you all. And then some additional stats from January of 2022 to September of 2022. We were up to 62 fentanyl deaths. Also for meth, we've had 88 meth involved deaths. So meth is continuing to be a crisis here in our county as well. So we don't want to let the opioid epidemic overshadow the fact that meth is still very prevalent in many of our communities. It's actually more than homicide and homicide with a gun here in Sacramento County. So a lot of concern around both opioids and methamphetamine. And then a couple more things. We have our continued county-wide naloxone distribution project. And so we were able to make Narcan available and accessible to many public-facing lobbies across Sacramento County, and also being supportive to providers and other organizations that contact us to at least get them the information on how they can order it through the California Naloxone Distribution Project themselves. And so we're just really trying to partner with anybody out in the community that is interested in getting Narcan. And then lastly, we're looking for a board member for our Alcohol and Drug Advisory Board. And we have one seat open, and we have a board meeting coming up on October 12th, 5:30 to 7:30, and it will be on the Zoom platform. So that's will conclude my report. Any questions? I see a couple.
Thank you very much. There are questions. Steve, your hand was up. Was that from the vote, or do you have a question? No. Okay. George, you had a question either for Lori or
yeah, thank you. I've been particularly interested in supervised injection facilities, and I'm wondering if this committee has taken a position on SIFs.
I believe that it hasn't come up for a few years, but previously we were very interested in supporting that effort. There are some, I think Phil can expand on some of the issues with that, but that's something we can address later. But currently, no, we don't have a recent stand on it, but we have tried to move
I
it.
actually visited the one in Vancouver several years ago and wrote an
Yes.
article in the SSVMS Medical Society Journal about it. If anybody's interested in seeing it, I can send it to Barla.
Yeah, definitely. They have had one there for, I don't know, decades, I think. Yeah. Phil, you had a question and I'm sure a comment on that, on George's inquiry.
Yeah, absolutely. It's definitely something that I'm interested in. While I was really disappointed to see Governor Newsom veto the legislation that got put forward this year that prevented the establishment of the SIFs in LA and San Francisco, and hopefully eventually Sacramento. But next legislative cycle, maybe. Yeah, my question for Lori, thank you so much for the update and the data. And I just wanted to follow up kind of on our previous conversation about kind of working on setting up some community stakeholder meetings and some more extensive discussion on accountability about how this data is used, with the concerns about utilizing this health data in law enforcement targeting exercises and stuff like that.
Definitely. Thank you for the question, Phil. So the next step is we still have to meet with the EMS leadership as well as the fire departments, because they're the ones who enter the data. So I want to get those groups as well as other stakeholders in the room. I was just happy to be able to get access to the system at this point. But moving forward, yeah, we certainly want to have those, and I will move forward and get those scheduled. So if there's particular, I mean, I can certainly invite everybody on this public health board, but if there's particular members that you want to see at the table and have a voice at the table, if you guys can shoot me an email, be happy to invite anybody that's recommended to be, you know, a voice at the table and to provide contribution to the conversation.
Yeah, absolutely. Happy to contribute however we can, and I hope we can have some community organizations that are kind of doing street outreach, and I think you know, hopefully some folks with lived experience out in the community also would be really good to have at that table. So
yeah, we have our Behavioral Health, Racial and Equity Committee, and so we have lots of organizations that we work with that will certainly add them to the distribution list, as well as all of our other boards and coalition members as well. So this blast will go out to hundreds of people that could have an opportunity to weigh in on the conversation.
Thanks for being so diligent on that front, Lori. Appreciate it.
Yeah, really. That's wonderful, Lori. Thank you so much. Very appreciated. Okay, any public comments, questions? No? All right, then we'll move on to our main feature. I want to welcome and thank Emily Halcon, who is the Director of Homeless Initiatives for the Sacramento County, for being here. This is a new office, a new program, so I know it's very busy for her, so we're doubly appreciative of her taking this time. And also Erin Johansson, she is the CEO of Hope Collaborative, and we welcome her back. She's been here a few times, and I think this is going to be a very rich discussion. We will hear about the new office, the new, I believe it's an office of homeless initiatives, and get an idea of the scope of that program and what we can see in the future. And we'll have Erin give us an idea of what's the experience from the other side, from the community partners, and working with the county. And so I'm going to, I guess, ask Emily to, as I said, give us an idea of the office, and then we'll open up discussion and for a little bit, and then we can hear from Erin, and then we'll have more discussion.
All right.
So
thank you so much, Farla. I appreciate the time. As she said, my name is Emily Halcon. I'm the county's director of homeless initiatives, and it's actually not a new office. I'm somewhat new to this role. But the office has existed since about 2017, when my predecessor, who retired, assumed this position. However, what is new is that the role of the office is growing, in part in response to the growing needs, and also to better provide consolidated services to folks who are living unsheltered and in our community. And I just wanted to acknowledge that I see two of my staff. You guys have worked for quite a long time with Liz Gomez, and I'm lucky to have her join my office from public health. So thank you, Dr. Kasirier, and I appreciate being able to have her. And then I also see Alex Led, who I think was, and Yesenia Wamani. So a few of my staff are on here as well, and just want to shout out to them the appreciation. Am I able to share my screen? Because I do have just a couple of slides. Okay.
Yeah.
Okay. So, and I'm going to keep this very high level, and Erin certainly will add to this, but I thought it might be good to have something, especially since we're in Zoom. I'm just going to sort of breeze through these because I think probably the most beneficial part of this will be the conversation. So I said a little bit of who I am and what the office is, a little bit more. So I sit in the county executive's office. And in that capacity, I'm able to work across departments. As I said, there's some internal administrative shifts coming to the county, and we're hoping to bring forward to the board pretty soon a recommendation to do consolidation, actually have program administration live within this office as well. Right now, I have a team of, I think we're 8 strong. We do not hold budgets, but we do have a lot of the planning functions around development of new programs and policies and recommendations, which include Liz, Alex, and Yesenia, who are on this, but a few other folks as well. Just really quickly, I always want to ground this. I talk a lot to the community about this, and at the end of the day, homelessness really is about the lack of affordable housing. You guys all know that. This is some stats out there. If you want to dig deeper into it, you should. I definitely recognize that a lot of conversations around homelessness typically, diverts into conversations around behavioral health and substance abuse and other things. And Erin certainly is an expert in those fields. But at the end of the day, homelessness really is a symptom of lack of access to affordable housing for folks across the spectrum. And so just always like to ground that because it's sometimes it can get lost in the conversation about the personal challenges people have, but I really, it's important that we continue to lift up the structural challenge. And the structural challenge is not about the people themselves, but about the structure that we're trying to work, swim upstream against in many times. I also don't need to spend a lot of time on this. You guys live here, you walk down the streets, you don't need data to tell you this, but our homeless population has expanded exponentially just in the time that we've been doing point-in-time counts. And the point-in-time count is at best a flawed count, but it's the best that we have over time to sort of look at the trajectory. And so this captures all the point-in-time counts throughout history. It started in 2007 all the way up until this year. And in addition to the raw numbers of folks who are experiencing homelessness, the other tremendously challenging part is you can see the flip in the blue and the green, whereas in 2011, 13, most folks who were living, who were experiencing homelessness in Sacramento County were sheltered. Now that inverse is true, and most people are living unsheltered, which obviously exacerbates health issues, other challenges to leave homelessness. A couple of things about the unsheltered population, because this is the population that tends to get the most focus, rightfully so. People living outside, that's not okay. At any night, we believe we have almost 7,000 people living unsheltered. That means in a vehicle, in the parkway, and in a tent under a bridge, lots of different situations. Lots and lots of data within the point in time count if you're interested, but some of the things that I wanted to lift up is, as with the overall homeless population, we see a dramatically disproportionate number of folks of color within the homeless population. 54% identify as a person of color. I believe that African Americans are overrepresented by about 3 times as they are in the overall Sacramento population. That is not Sacramento specific. That tends to hold true across large metropolitan areas. And it's something that we as a community really need to grapple with and need to make sure that as we lift up programs and policies that we're really thinking with a racial equity lens. You know, people ask about the growth in homelessness and whether more people are becoming homeless. And the answer is yes, but yes, and people are staying homeless for a lot longer than they used to. Almost 3/4 of the people outside on the night of the point in time count said they've been continuously homeless for almost a year. That was unheard of in, you know, just recent years, because we had a system that could catch people quickly and at least get them into shelter. We no longer have that. So people are staying outside, and as you stay outside, the other conditions within your life exacerbate, and the climb out of homelessness just becomes that much steeper. Important for this committee, almost 60% of folks report a disabling condition or more than one disabling condition. That could be mental conditions, traumatic brain injury, certainly substance abuse and mental health issues. But the people who are on our streets, basically the theme is people who are on our streets are sicker and have been on the streets longer. Also, if you look at age ranges, people are aging on the streets in a way that we didn't used to see. And then I always like to say this, because the sort of rhetoric that we often hear is, where do they come from? Who are they? Well, they're from here, and they are our neighbors. 92% of people in the point in time count identify as being from Sacramento. That means they were born here, they have family here, they had a job here and lost it. This has been consistent throughout the years, but it continues to be sort of a question that the general public grapples with. But at the end of the day, folks living on the streets are indeed our neighbors. They are part of the Sacramento fabric. And so it's our responsibility to fold them into that. And then just circling back to my first slide, which is all about housing. If you ask people who are homeless as well, they will say it's all about housing. Throughout the populations, whether it's youth or elderly folks or veterans, everybody who's homeless, or not everybody, but the majority of folks who are homeless, identify that the #1 barrier and the #1 need that they have is access to affordable housing. So just a little bit about our capacity, and this is, if we showed this over time, it wouldn't look like this. We have a pretty robust homeless support response system. We have almost 3,000 shelter beds at any point in time. We have over 4,000 permanent housing units exclusively for folks experiencing homelessness. Obviously, lots of people exit homelessness into the market and don't ever touch a drop of affordable housing or go back to family and friends. But what's interesting to hear on this to me is that we're starting to see a shift over time, that the blue chunk, the crisis response, is growing much quicker than the orange chunk, which is the permanent capacity. If you looked at this chart from 2, 3, 4 years ago, you would see more orange and less blue. And what that tells us is we're responding to a crisis on the street. But a healthy system, if we had a healthy and balanced system, you would see very little crisis response, and you see a lot of housing availability, both at the front end to keep people housed and to prevent them from falling into homelessness, and enough capacity at the end to exit. Obviously, we need shelter right now. We need a place for people to go tonight. It doesn't say we can wait, but it is troubling as we start to see the community's response by necessity turning to the creation of crisis response sheltering units. Also, I should say a little bit of this is influenced by COVID, when we opened in a huge chunk in a really short amount of time, Project Room Keep units to respond to, in addition to spreading the disease. So this might be a little bit skewed by that. Finally, I just want to say a little bit what the community is doing, and specifically what the county is doing. So, and Erin certainly had a big hand in this, and her and I can both talk about this. Despite what you might see, that the city, the county, the other cities, our nonprofit community, our faith community are working really hard and working in concert with each other. Just a few months ago, the city council, the board of supervisors, and the continuum of care board all adopted what we call our local homelessness action plan. And we're now putting teeth into that plan. It has 6 very high level strategies. You can see them here. None of them should be surprising to you. They sort of are, yep, that's what you need to do. You need to have housing, you need to have access to housing, you need to have behavioral health services, you need to have capacity. And so now with this, the framework that's been adopted and endorsed by all the major entities, we are working to put behind this all the programs and expenditures and policies that we're driving locally to realize what the outcomes of this homeless action plan. A couple of things I want to highlight the county is doing. So I think these are the things you read about quite a bit, and I'm assuming there will be some questions. This is not an entirety of what the county is doing, and certainly happy to address questions on any of them. We're doing a lot of work, as I mentioned before, a lot of work in the crisis response. We're doing a lot of work in outreach and encampment. About 1.5 years ago, the county launched a new way to sort of engage with folks living outside. For a long time, we have had really, really great social workers and housing navigators and outreach navigators working in encampments sort of on a one-off basis, trying to respond to crisis moments. About 1.5 years, 2 years ago, we tried to pivot and create what we call encampment services teams. And the difference here is that these are proactive teams. They are case carrying, they are multidisciplinary, and they're going into target encampments either where they're very large, they have specific, especially vulnerable folks. They have been difficult to serve with sort of more traditional services. And the goal of the encampment services team really is to spend time in an encampment, engage people. We know that it often takes a lot of time and a lot of different efforts, and to bring with that team real-time sheltering and rehousing. Even though the bullet is on here, I do need to acknowledge that that is not always the case. This is somewhat aspirational, but these teams do go in, they'll spend 6, 8, 12 weeks working in the same camp, trying to find a resolution for each and every person. Obviously, that's a slow process given the number of camps we have, but we are seeing effectiveness when we sort of change the way we interact with folks living outside. In addition to that, we are not able to get encampment teams out into every encampment at all time, but we're also trying to provide supports in those encampments. That includes sanitation stations that were set up during COVID. We're continuing those, delivery of water into encampments, and then debris removal. This is in partnership with some of our waste removal folks to both clean up the streets so that the community is has less concerns, but also to provide a sense of sanitation and for the folks living in encampments. The second thing that we've been focusing a lot on the community as a whole, but this is the county in particular, this is not to say that others aren't doing this as well, really trying to change the way that we provide sheltering and rehousing. One of the things we learned during COVID was, and I think we've always sort of known this, but traditionally we've provided sheltering in large congregate spaces where people have to sort of cohabitate with people who they may or may not know, may or may not trust, may or may not feel safe around. And so in COVID, when we were forced for the first time really to create large quantities of non-congregate sheltering, we saw that people who had previously been labeled service resistant, they're not service resistant, they just didn't want what we were able to offer for lots of reasons. And so we're trying to create more non-congregate sheltering. We're calling them safe stay programs. If you live around the South area, you may see one of them popping up. That's the picture at the top left here. We have 2 approved, a couple more, fingers crossed, will be in front of the board in a couple of weeks. And the idea here is these are place-based shelters in communities where we know people are living unsheltered. We can invite them in with low or no barriers. You can come as you are with your pets, with your possessions, with your partners, however you present as a household, and receive wraparound services aimed with exiting. But the big difference here is you get your own place that can close a door, that you can put your stuff in and play safe and secure. We're really confident that this is going to be a real asset, not just to the folks who are living outside, but also to the communities in which they are hosted in, because these are the communities where there's lots of unsheltered and unsanctioned camping right now. And frankly, we get lots and lots of really legitimate community concerns about the impacts of those camps in the community. So we'll have the first one at Florin and Power End hopefully open in the next few months and a few more following. The final thing I want to highlight is, because I started with it's all about housing, is that how can we also create housing opportunities? Certainly building housing is important. It's not something that the county necessarily does. We work closely with the Housing Authority and other partners, and we'll advocate for any building of any housing, affordable all the way up. But some of the things that we are creating, we just awarded the contract for what we're calling the Landlord Engagement and Assistance Program. It's $10 million the board has made to help to have one single entity help to work with all of our other nonprofits, the Hope Cooperatives, the others of the world, to develop and maintain a landlord pool, landlords who will accept clients we're working with, facilitate matches from a specific client into a housing unit, and really create more efficiencies for folks who are sitting. We have lots of people sitting on housing subsidies, whether it be a voucher program or another program, and it can't translate into housing. And so with this new program, we're really hoping it'll create an engine for the entire system that can refer into and help people exit either from a shelter or straight from the streets. And then finally, and I hope this pivots nicely into Erin, because I know she's a system thinker too. I just want to lift up, I just sort of ran through a bunch of programs, and a bunch of programs alone aren't good. So how can we as a system think about opportunities to improve? A couple of, big picture things is this comes out a lot. It's not all true in the newspaper, but how do we row better in the same direction? How do we clarify who's doing what and how we're working together? It's confusing enough for all of us. I can only imagine how confusing it is for consumers. How do we measure the impact of our investments? We are all doing really, really good things, but if we're not able to show to the general public, to our consumers, the efficacy, and you're not able to see a difference, then we're not doing the job we need to be doing. And then finally, something that I'm sure I'm going to hear, I've heard already a little bit from this group, so I really appreciate you guys lifting up, is how do we make sure that what we're doing is consumer oriented? How are we addressing the needs that those who are living outside express that they need? How do we clear up access for them? How do we lift up their voices as we develop new programs and policies? So I'm going to stop there. I really, really want to hear from you guys if there's concerns, opportunities, challenges you might lift up, and really appreciate this opportunity to go through that really quickly.
Okay, I think I'll save my numerous questions because I saw some hands up, and thank you for the wonderful overview. I'm sure other people have questions. Steve, you had your hand up.
Yes, thank you. 3 or 4 slides back, you showed capacity at various levels in the system, about 8,000 beds total. If I, all my fingers and toes, added it up correctly.
Yeah, I think if you added up shelters and housing, that would come to, yeah, I think you're right, mathematically.
So what's the occupancy percentage?
Yeah, so I'd say on the permanent housing, it's virtually 100%. But and the reality is that even though there's 4,000 units of permanent housing, it's permanent, so it doesn't turn over by design, right? So it's very infrequent that we would have a permanent housing unit not occupied, except if we can't find a landlord, which is one of the reasons. On the shelter capacity, different shelters have different utilization. It's pretty close to 90 to 100% on most nights. So, we don't have a lot of unused capacity.
Thank you.
Mm-hmm. Phil, you had your hand up. Thanks.
Yeah, thank you so much for this awesome presentation. I really, really appreciate it. So couple questions. The safe stay communities sound really awesome, and I appreciate the emphasis on them being low barrier. And I hope that program expands. Had a couple of questions about kind of the encampment outreach services, and kind of following some of the debates at the county and the city regarding the recent ordinances that passed. So like the water delivery and the sanitation stations, I think that's so awesome. And so much of the concern that was expressed by the community was about, contamination of waterways and things like that. So I wonder, first off, if there's any conversation about kind of like toilets or other, other means of allowing people to have facilities to use, which is not often an option for many people living outdoors. And then kind of along that same vein, I know you mentioned kind of the debris removal. And I know that the way that I've seen it kind of implemented in the community, it's often kind of reactionary to debris accumulation. And so I'm wondering if there's any kind of conversations about some more like proactive garbage collection, as most of these, encampments don't have a means of disposing of their refuse. And so it obviously accumulates. And so I'm just wondering if there's any conversations about kind of more proactive ways to address those concerns.
Yeah, no, thanks. I'm going to start with the last question and then go to sanitation, and Liz may even want to jump in because she I actually the brainchild behind the sanitation. But on the debris removal, you are correct that a lot of times the debris removal is reactive to sort of build up of debris and or community complaints. We have a couple things. So we have a contract with an organization called Forensic Clean who does this cleanup, and they do both a proactive and a reactive. So they do the reactive ones where debris is accumulated, community concerns, but they also have a regular route that they go through. So we've identified these are some large encampments, some critical areas, and they have, Tuesdays we're here, Wednesdays we're here, and they do a really good job. They actually employ a lot of folks with lived experience. They do a pretty good job of engaging folks in those encampments. And so that's more of a proactive thing. Like, we're going to be here every Wednesday, here's some garbage bags, fill things up. In addition, as part of the fiscal year budget, there was some money to sort of pilot this effort in the Parkway in particular, where we provide folks living in encampments incentives to clean up themselves, like gift card type things. We haven't yet launched that, but we have some navigators working in the Parkway, and the intent here would be to say, as you're engaging with folks, provide them the resources and ability to do their own debris removal and some incentives to do that, and then come and collect it. We certainly don't have enough, but those are different ways we're trying to address debris removal. On the sanitation stations, so Liz, please correct me, but I believe we currently have contracts for about 25 sanitation stations and camps. Those include porta potties as well as hand washing stations. Again, not enough, but it's targeted towards encampments where there's either they're larger or they don't have as easy access to traditionally public restrooms. That was launched during COVID, and so we targeted camps based on spread of disease. And now, as we're pivoting, we're sort of rethinking where those stations might best be deployed. Again, it's not going to be for every camp, but trying to target those camps where that lack of access to sanitation is most severe. I don't know if Liz wants to add any more, if I answered all your questions.
Yeah, that's great. Thanks, Emily. I'm double checking the numbers right now, and I'll update if there's any updates.
I think it's 24 or 25, but let's let you know for sure.
Yeah, thank you.
I can save some of my other questions. I would like if you could share some information on the landlord engagement program. If you could maybe email that to our group or something.
Yeah, and actually, my staff person, Yesenia, I'm not going to put her on the spot, but she's on here. She is the mastermind behind that, so I will ask her to email to either through Liz. We'll get it to Farla, and she can get out to the group. We have some FAQs and stuff like that.
Wonderful. Thank you.
Thank you. George?
Yeah, thank you very much. That was a very interesting presentation. My concern is also this sanitation stations. It seems to me about a year and a half ago, one of the advocate groups for homeless people had put porta potties out in some of these areas, and they'd been taken up by the county. Is that still happening, or has that been resolved?
So at the front, what I believe you might be talking about is the very, very beginning of COVID, before we sort of had a collective response. There were some local nonprofits who placed restrooms sort of at their own dime for a couple of months. Those stations, for the most part, were either removed or were incorporated into the county's response. I'm not aware that that is still going on. It was something that happened at the front end of COVID. There may still be some local nonprofits who have on their own. I've seen it, for example, some churches will place them, but I don't believe the ones that you're referring to. I think that was a COVID response.
Okay. Libby, you had a question?
I do. I have a couple of questions. First, thanks for the presentation. Super interesting and great to see the breadth of work that's happening. First question, so somewhere at the beginning of the presentation, you cited that I think it was 44%, somewhere in the 40s, of respondents indicated that affordable housing was their greatest barrier to exiting houselessness. I'm curious what the other responses were and what sort of share they represent. Second question is, I guess, sort of my takeaway from the presentation, and please correct me if you want us to have other sort of key takeaways, but one takeaway I think is that the shortage of permanent supportive housing is one of the biggest sort of issues that we're facing, especially as we're kind of like forward looking to these trends and potentially growing populations. if you could just speak a little bit more, sort of what are the threats that we're facing to address that, and what are the opportunities? How do you see the way forward on addressing that shortage? And a second part of that question, a sub-question, is how much of that sits with the county versus the state versus other entities, and what more can we be doing as a county to try to address that gap?
Okay, that's a lot. And I might tag team with Erin, who actually develops affordable housing. But let me answer the first question. So that data came from the point in time count. And so I can certainly pull it out and look at the entire, my recollection. So this is a free form question at the end of the point in time count. They ask people, so there's no pre-conceit, and then they try to categorize it. My recollection of the other top things are lack of income, other things that sort of pivot around that same thing of like, I don't have money and I can't afford housing and the housing isn't available. You see some other themes, and I can certainly highlight which page on the point in time count, which is details them all. But my recollection is it tends to be around that same theme of having money to afford housing and having access to housing. On the affordable housing, what I'm going to say what my biggest thing is, I'm going to ask Erin to jump in, she actually develops housing, is it's really, really expensive to develop housing, especially affordable housing, targeting folks who are exiting homelessness. The amount of subsidy per unit is astronomical. And so that, and then I guess the second thing, which I'm not sure how much of this hinders, but there's lots of NIMBYism out there. So I don't know if I stole Erin's, but she actually develops housing, so she gets me.
Yeah, I mean, I'll jump in right here. First of all, I just wanted to remind you that my name is Erin Johansson, and I'm the CEO of Hope Cooperative. And we are also, I'm also the COC chair, so the chair of the Continuum of Care Board, and have served on that board with Emily for a long time. So we have similar sets of information. But in terms of affordable housing, and especially the PSH, Emily is 100% right. It's very expensive to build. But I think in addition to the expense, it's very slow. You need about 8 different funding streams to build an affordable housing project. And those all have timing and rounds, and some are federal and some are state and some are local. And all of that is very complex, and it takes a really long time. As an example, I'm really excited to say that my very, very first project that I ever spearheaded in my organization will be occupied at the end of December. I started working on that project 7 years ago, 7. And we were only really delayed 1 year in that we didn't make the, we didn't get awarded in the competition. So minus that 1 year, it still would have been 6 years if everything would have gone well. So that is part of the problem with permanent supported housing. But the second part of the problem that Emily touched on is the NIMBY factor. And that is that we get a lot of resistance when we try to build a permanent supported housing project. You have to do a lot of community outreach. You have to really engage the community. All of those things are true. The state has put some legislation in place to prevent jurisdictions and communities from actually stopping projects like that from going in just for this reason, but jurisdictions find ways around it when they have community objections. So you could buy a piece of land, meet all the criteria, get in front of the city council and have your project denied, which is what I'm going through currently with another project in Elk Grove. So it is a problem in getting these projects built. I think that Emily's really on the right track in terms of the landlord engagement, but as a provider that's been housing people coming from homelessness for 40 years in Sacramento, and we have 67 landlords that we work with right now for our rental assistance vouchers that we get from HUD. And we are scrambling all the time because the vacancy rate is so low in Sacramento, in the Sacramento region, that, I mean, even if we increase the number of landlords that will work with us, which I definitely support what Emily's doing there, I have worry that her $10 million competes with my $3 million, competes with SHRA's emergency housing voucher programs, and that we're all trying to go after the same folks because the pool is so small. So building and engaging, all of the above has to happen. And I am 100% on team need more housing of all types, because that is really the only way that we're going to actually make real headway.
Thank you both. It's a complex issue, and yet so simple.
Yeah.
Seemingly simple, provide more housing, but very complex. Liz, you had a question, and then Sarah.
Sure. Thank you so much, both of you, for your work and for the presentation. I have a few questions. So actually just got a new one for listening to Libby's. So it sounds like, and correct me if I'm wrong, please. So it sounds like the primary kind of strategy of building more affordable housing is like this private partnership, public-private partnership with private developers. And I'm wondering if the county and if Hope Cooperative as well is exploring like building publicly owned housing, and for example, in partnership with the federal government. And, you know, I'm not a housing expert, so I wanted to just ask that question. So that's my first question. Second question is, there's a recent county report that said about 30% of people who are booked in the jail are housed and often released shortly after. So I'm curious what, I believe y'all are working on this very important issue. I'm just wondering what is being done about reentry work and connecting folks to services when they're being released from jail, especially unhoused folks. And sorry, my last question is maybe a little simpler to answer, which is that about a year ago or so, there was a public video of a forensic clean staff member pulling a knife on an unhoused person. And I would drop I don't really even want to see the video again. It was very disturbing. But it's, if you Google forensic clean, you can probably find it. But I'm wondering if that issue has been addressed in any way, just because I've heard of quite a few instances of forensic clean being very hostile with community members who live outside.
I'll start with the last one. I hadn't heard of that, so I will look into that. I've never heard of that. But I'll look into it. Was it here in Sacramento?
Yeah, I think it was actually really close. I'm a homeowner in the city, and it was near like the Alhambra Broadway underpass. I believe that's where it happened.
Okay, I first I'm hearing it, so thanks for lifting it up. Definitely will look into it. Going back to your first question about sort of public funded, so that as a victim of the loss of redevelopment, we used to have a thing called redevelopment in our state. We no longer do. And that was sort of a mechanism to drive sort of more public-private development of affordable housing. There was 20% of the tax increment dollars in all redevelopment areas were set aside specifically for this. And if we were to look at the development of permanent supportive housing over time, you'd see this like stark stop when redevelopment went away because we lost that mechanism. So whether the government steps back into it, I will say that we tend not to be the most efficient or cost effective. So, the way that I saw it, when I worked at the redevelopment agency for 10 years is that really strong public-private partnership where we had this dedicated funding stream. With the loss of redevelopment, Aaron's job just became that much harder, but I'm not sure if saying county, you should build and own the housing is more efficient. We should certainly be strong partners in helping her break down barriers and helping make the planning and entitlement process more accessible, but we are not, government is not often very nimble or cost efficient. I don't know if Erin, you have other thoughts on that.
Yeah, I wanted to just touch on the federal government because the federal government is really out of the capital funding of development projects as well. So that used to happen. HUD used to have a lot more investment in building housing units, and they don't have as much anymore as they did. So it really is more the state and the private development community. Where the county comes in strongly is with the funding of the services in permanent supported housing, which is also a critical thing. And, having the unit is one essential thing. We're all saying we need the unit, we need somewhere for people to be. But those people coming from homelessness, who have been homeless longer, who have greater challenges also desperately need those services so that they can remain housed and be successful in housing. And right now, the only game in service provision is behavioral health. And that can't be the only game. And that's part of the reason, that's part of what holds up permanent supported housing, is that we don't have any real dedicated funding stream to provide those services. So I don't want to miss that point. And I have personally spent the last year trying to make CalAIM that funding source. And I'm making some headway. So not me by myself, but we are making some headway in that direction. CalAIM, as you all probably know, is Medi-Cal, is a Medi-Cal benefit. So if we can make that happen, that will really open the door to more PSH projects with services that are funded. But the mechanisms that, as Emily said, having the government own the properties is probably not something we're going to see anytime soon. There are plenty of private developers that are invested in doing this work in partnership with jurisdictions and in doing that public-private partnership. I think that the answer is to make it faster and make it cheaper, so that more projects can get built.
And then just quickly, because I think you asked something about reentry. I think that is a huge challenge we face. We are working, probably not as intensely as we should on some of those discharges. Some of the funky bureaucracy that Aaron and I live in sometimes is that HUD, the world that funds a lot of the stuff that we do, defines people as homeless who are in institutions, including jails, as not homeless the moment that they're in an institution for 91 days or longer, and regardless of sort of where they entered from. And we also know that folks who entered housed often exit unhoused. And so it is a challenge. I think that with CalAIM that Aaron just mentioned, we're going to have a little more flexibility and not be so tied to some of these rigid federal definitions. Also, our community is moving towards a coordinated access system where anybody, whether you're yourself unsheltered, you're a jail discharged person, you're a hospital discharged, you're just a concerned citizen, can call a single line and get access theoretically to shelters. The biggest challenge there is that we don't have capacity. So, but there will be at least one single front door so that you won't have to exit the jail onto the streets, encounter a navigator, but it's building both sides of it, the front door as well as the back door. So there's actually capacity. But definitely I would say the jail discharge is one of the places we need to work more intensely than we are now.
I want to throw something in about that too, that it's a county program. So there is a brand new, what is a forensic FSP that opened this last year. So folks that are getting jail released that have a serious mental illness and qualify for county mental health services can have their own dedicated full service partnership. And I think it's I can't remember what the census is. Maybe it's close to 200, and their housing resources are part of that. So that's actually new and wonderful because we didn't have that before. So so that helps. They will also, if you are referred to that program while in custody, they will meet that person as they're released and help them from there on out. So that's a really new, great program.
So Sarah had a question, and I just want to say that after that question is answered, I'd like to turn it to Erin for her presentation or overview, and then we can come back to these questions. I also wanted to remind people, Emily and Erin, if we have time, could you please address the issue of centers, safe centers for cooling and heating, and we talked about getting around to those issues as well. So Sarah, you had a question.
Yeah, first I just thank you so much. This is such a I think Farley means so complex, right? That it just feels so overwhelming as somebody who's coming back into this area, and I've worked in a different sector, and I really appreciate how you were able to portray the complexity in a simple way, right? And so thank you. That, at least for me, I really appreciated this presentation today. I guess I think about So I just want to absorb this and, be more intentional with sort of what you presented, and I'll be curious to see how it intersects with other things that we do, or if it does, right, Farla, how this plays in. But that being said, my question, it's interesting. I was reading an old study just the other day, another reason why, but from New York, where they had found that for predominantly women, but people who became, houseless within the first 3 weeks, if you could catch them, right? Okay, so this. So the attrition then back into, being in a home versus somebody who's the longer you've been out, more complex, and hearing that you're moving, it sounds like you're really moving as hard as you can into sort of a more multi-sectoral supportive stream couched in housing. Who looks at these sort of more of the early preventative, right? So somebody's on the street, or let's catch her early. It's been 2 days, it's been a week, or I'm not talking about the sort of rent, how do we make it so people stay in their house? I think that's probably a whole other world, but how does that intersection play with what you all are doing of that sort of early catch, how to get people back, either into their home or prevent from losing how does that work in this big picture? Just to back it up a minute.
So if I can share my screen, I think I can touch on that, if that's okay. And I really want to say that I am really excited that Emily did the homeless action that she talked about. Can you guys see this homeless response system slide? Okay, so the local homelessness action plan, because I am actually going to go back to that for just a second, because I want to really emphasize a couple things. But so my materials are all coming from the continuum of care from Sacramento Steps Forward. So, but I want to, before I complete, I will talk about our new outreach and engagement center, which is what Farla asked me to talk about. So, but I want to continue on because this conversation is so important. So the homeless response system interventions consist of 3 major components, and one is to prevent homelessness. So targeted prevention and diversion, and that's what you were just asking about. Short-term prevention assistance for the highest risk of people that are going to become homeless shortly, and diversion, immediate problem solving and resources to avoid shelter. So those 2 things are the very front end homelessness. What we talked about when Emily mentioned the coordinated access system, and I'll talk a little bit more about that in a minute, but that will include this prevention and diversion piece, so that when you call that one place and you are a concerned citizen working with a person on the street, an outreach navigator, a person yourself who's struggling, the idea of that coordinated access system is to sort of triage your needs in the moment. What is it that we can do for you right now to either prevent your homelessness, or to intervene when you're already homeless, like connect you with an outreach navigator, get you some temporary housing, and then ultimately end your homelessness with short-term rehousing or permanent housing. So those are like the components. And we all talk about how complex it is, but it's really this simple. But it's not simple in making all that happen, and the execution is not simple, but the strategies are. And one of the things I think that I just really want to focus on with the homeless action plan that Emily already talked about is that one of the big problems, and it's no secret, it's the elephant in the living room, that we have had not a cohesive approach regionally. The cities, the counties, the nonprofits, the continuum of care, all of us are trying to solve for this, the hospital systems, and everybody wasn't really on the same page. So for a decade, we all worked in our silos trying to solve for this problem. And what is new about this local homelessness action plan, and why I'm finally hopeful after doing this for a long time, is because everybody bought into this very simple strategy here. And the number one is to build and scale a coordinated access system. For me, that's the single greatest achievement of our lives, because what has happened previously is that the city had some resources, and the county had some resources, and the smaller cities had some resources, and the hospitals had some resources. And if you were a person experiencing homelessness, you had to have an inside track. You had to have somebody's phone number to help you through that. And that woman that you talked about who is about to become homeless had to know me or Emily or someone at the city to be able to really get some assistance with her her immediate concern. And we can't, that's not a system. That's not a systems approach. So having a one place for that person to call that will get connected to those prevention and diversion resources when that's what they need, or have emergency shelter when that's what they need, or get into the queue for permanent supported housing when that's what they need, that will really streamline the process. And Emily talked earlier about the how many shelter beds we have, which is a lot, and they're mostly full, but they're not always all full. So if we have a night where we have a bed going vacant, that's a place where a person isn't safe and a person could be safe. So having the coordinated access system not only manage all of the resources we have, but have those resources in real time available to the access system so that they can connect the person with the resource, that's really going to make our system more efficient. So do we need more of everything? Yes, we do. But if we were doing a better job using what we have, then we would at least help more people and reduce the numbers that we have. So, so this action plan bought into by the city, the county, and the continuum of care is groundbreaking. And if we do it well, we're going to see homelessness addressed in some real way. But if we don't get some more housing units, if we don't get some more landlord engagement, if we don't get some places for people to exit to, then this system will be bottlenecked as we have been for years. So that's something that I just really wanted to just emphasize, the collaboration that is essential and necessary. And I think we're there, at least, I mean, in principle, we're there. There's fine tuning that still needs to happen, but definitely, I think we've made progress. So before I jump into like a whole nother left turn, have we missed anything, or have we, or are there any other burning questions on sort of the response system and what we're trying to build as a community? Okay, I don't see any. Oh, yeah, you have one.
Well, you have your hand up?
I do. And I guess just acknowledging that, as you've all said over and over, it's super simple, but also really complex to initiate. Hearing as structural housing and increasing access to housing is really the end game and the long game. Are there any low-hanging fruits that you see on a more immediate horizon? Hearing that it could take 6 to 8 years to build new developments, to get all the necessary funding. Are there other things that kind of can be done, or to help reach those goals, or milestones that you see to help reach those goals?
I mean, for me, one of the things that I've been exploring, and I haven't really made any traction on it, but I have been exploring as an agency, is conventionally building housing, like small complexes, maybe 40 studio units with conventional financing and donor dollars, to see if we can get some things built quicker, that then we could use those vouchers. One of the, there's a lot of vouchers out there. SHRA has issued lots of housing choice vouchers, emergency housing vouchers. There's HUD continuum of care vouchers. I heard SHRA say recently that there's 1,000 people on the street right now holding a voucher where they can't use it. So the landlord engagement services will help, but there's also not 1,000 vacant units just sitting out there either. So if we could get some conventionally built things that could happen sooner, then maybe that would be a strategy that we could use. The home key efforts are also much quicker than building from scratch. I'm currently working on one in the city right this minute that would have 85 units, and that takes about a year. They're all small studios, and but they can be done quickly if everything aligns. So I think those are some of the faster routes, while we continue to push on permanent supported housing and getting those units built for the future.
Out of curiosity, is the one in the city the one over on 9th and K, I think, the one that they're renovating.
No, it's not in
No.
downtown. There is
Oh,
one
okay.
in the city already. That is
Okay.
the Capitol Park Hotel. That's going to be open pretty soon. I
Okay,
think you're
awesome.
talking about. Yeah. And that's very big. That's a 100 plus. I don't know exactly the number, 130 maybe. But that's almost done. So that one's happening. But that needed exhaustive renovation. So that took quite a bit longer than some of the because that was a No Place Like Home project using
Right.
Mental Health Services Act funds.
Right.
Home Key is taking a motel that needs kind of minor renovation. So the one that I'm looking at doing right now already has little kitchenettes.
Okay.
So, but that's a big time saver and money saver when that already happens, and that needs some minor renovations that's designed to be about 9 months to a year to occupancy. So those are very fast if you can get some of those online.
Okay. I would be interested to hear more, but I know that there's sort of other things if possible. And maybe at the end, if there's some time to ask some follow-up questions, that would be great.
Sure.
Thank you.
Absolutely. Yeah.
Lori? You have a
Hi,
question?
Erin. Always great to see you and great presentation by you and Emily. I just want to say that very appreciative of just behavioral health involvement in this, and our teams partnering, and making sure that the encampment teams, have the resources that they need and are able to provide both the mental health and substance use assessments. So again, reach out to my team if there's any other support that we can provide to you.
I just want to say for everyone to hear that's in this meeting is that Lori and her team, amazing. Like the collaboration that we get out of the substance use disorder team is amazing. They are accessible and willing to partner with everyone. So thank you, Lori, for everything that you do and have been doing for years. Great partnership. I think I want to jump into some of the temporary, what Farla asked about cooling, warming, and smoke centers for people experiencing homelessness. And I want to tie that back to Emily talked a lot about the county's strategies towards encampment teams, and the city of Sacramento also has an approach for doing homeless outreach. And my team is connected with the city team doing homeless outreach throughout the city of Sacramento. And the Department of Community Response is the lead there with the city. And they do a similar strategy to what Emily's talking about. They interact with folks on a proactive basis, as does my team. And I think what I really want to call out is that we hear a lot about service resistance. We hear a lot about people don't really want help. And what we know and what we find is that people they're frustrated. They've suffered so much distrust. Some of them have been on lists for years trying to get into housing, and they just don't really think it's going to happen for them. So a lot of the resistance comes from that, a lack of trust in the system. So a lot of times what we say is that it's a repeated, intensive engagement approach with folks, where you go back repeatedly. First time you just introduce yourself and give somebody a bottle of water. Sometimes it's getting somebody an ID before they're going to really connect. And so the most recent effort in that strategy is the Outreach and Engagement Center that we just opened last week on Auburn Boulevard in the Old Science Center. And it's a fairly controversial little location because it's a city-owned building in the midst of the county all around it. So the residents the neighboring residents are county residents, and the business owners across the street are county constituents. So it's been a little bit tough getting it going. But what the idea of that project is a place where it's really temporary. So it's not even like you get into that shelter and you're there until you're in permanent housing. It is by referral, Department of Community Response, and our team doing outreach, finding that person who is ready to come out of the elements and take their next step forward. So maybe there's not a shelter bed available for them tonight, but maybe there is in 2 or 3 days. So we bring them in, we have a place for their dogs, place to store some of their stuff, and to really have a staff person listen to them and try to figure it out what it is they need. And we're working with Lori's team, we're working with behavioral health to make sure that if they need those kind of services, that they get assessed and referred immediately. Our team is a CalAIM enhanced care management provider as well. So if we can get folks connected to that service right then and there, then we can, it's sort of like somebody asked about low-hanging fruit. And I think that's really what this is designed to be, is that, like, yeah, can we get you connected to mental health services so that that team can take it from here? Can we get you connected to CalAIM so that that team can take it from here? Can we get you connected with substance abuse services, and that team can help? Can we get you into a sober living bed, which we're going to be opening thanks to Lori's team in November? So we've got a lot of like resources out there. They're a varied pool of resources, and people are individuals and they need something different. So if we can spend that few moments to really connect with a person and deeply listen to them and get them connected to the next right thing, then we can have some flow in the system. So that's what that center is designed for. It will also be available to be a cooling, warming, and smoke center, but it's only for 50 people at a time. So we know that there's a lot more need out there. The county has done a really good job through DHA opening their offices for those kind of needs, and Emily can talk a little bit more about that. I know that the city intended to open more of the types of centers that, like what we just opened. We're piloting this. We're trying to see if this is the right approach, and then there might be more of those coming in the future. And it's really sort of trying to work together with all the other systems that are out there, primary care, street nurse. We're working on veterinary partnerships so that we can really address whatever that person's need in the moment is, so that they can start thinking about their next right step. One of the things we find for people when they're out on the streets is their first priority is to remain safe. So they can't think about their substance use. They can't think about their mental health. They can't even think about their dog's veterinary needs when they're living on the street. They need to have some place where they feel safe in order to be able to open up themselves to those next right steps. So that really, I think, is where I wanted to leave it. Emily, do you want to add anything about those cooling centers or warming, or what the county's approach is?
Yeah, the only thing I'll add about cooling and warming centers is, Erin's correct. It's a real challenge. It's a challenge to activate quickly, because oftentimes weather comes pretty quickly, and it's hard to facilitate places where everybody is, because you need 100 spaces throughout. I mean, I don't know, I'm making that. So Erin is right that historically the county has opened our DHA bureau offices, and we continue to do that. What we found more success within than those, because people have to transport themselves there. Sometimes we get partners with RT, which is great. And typically you have to, leave some of your stuff, or pack it up and bring it, which is, either of those options is really, really difficult. So we found some more success in recent weather events with mobilizing additional motel vouchers and some of the with our community partners. So working with our outreach teams who are in those encampments, who know who's the most vulnerable. In some of the really heightened weather events, when it's been super hot or super cold or windy, we have, over a course of 3 to 5 days, activated 100+ additional motel vouchers. Now it's a very short stay. It's during the course of the weather, and once the weather is okay again. But it seems to be easier to facilitate people who are in diverse geographies. It obviously needs a lot of person power, because somebody has to go out into the camp. So trying to do both, but it's a real big challenge. We often open our DHA bureaus, and some of them are pretty well received, and some of them only a handful of people go in. And even if we're helping a couple people, that's good, but knowing that you have capacity for 50 and 3 people are there, it's challenging. So yeah, I'll be very interested to see how the center that Hope Cooperative, since it's going to be a stable place, if maybe that will change the way the community reacts.
And we're actually doing the transport during the most recent heat wave. We had about 47 people take advantage of that center, and it really isn't in the most convenient location. So transportation is definitely an issue, and we will plan to be partnering with RT in the future.
Excellent. So glad to hear that. Phil, you have your hand up.
Yeah, I just wanted to provide some feedback. I know during this last heat wave, there were a few clients that I was working with that and got feedback from many more that, you know, there was a lot of confusion about what was actually available and kind of like, you know, when the weather forecast comes in, then are they going to be activated or not? And I think from a lot of the community perspective, it kind of happens in a somewhat unpredictable way. And then accessing them, kind of knowing where they're located, you know, like I looked it up on my phone to help people, and like, you know, I had trouble kind of navigating it and finding out exactly what it was, and then figuring out if they were eligible for transportation and if transportation was available. It was like there was just a whole bunch of confusion. And then other members of my team spent kind of hours trying to identify these motel vouchers and called 311 and reach out to outreach workers, and the outreach workers told us to call 311 and 311 told us to call the outreach workers. And it was just like this whole circular mess, and ended up just being really frustrating. And there were some like particularly vulnerable people that I know really could have benefited from that. And so I just wanted to provide that feedback. I know that's not like super constructive, but I think, like, you know, increasing the consistency and accessibility, like you kind of mentioned the geographic locations. I really hope that those are at front of mind, like especially as these weather events are, you know, clearly going to be more severe and more frequent in the coming future. So yeah.
I think that the coordinated access is going to help with this, because when 211 is the number, because I mean, what you experienced, what you just described, Phil, I think every one of us has had that experience. And that level of frustration when you are trying to help somebody and you're calling all over the place and you don't have the right phone number and you keep getting sent in a circular pattern, that is what has driven the whole idea of the coordinated access system. So we hope to have that up and running in the next couple of months, where 211 will be the central phone number that you would call, and that they will have the most recent information and the most real-time information about those cooling, warming, and smoke centers when they're available. So I think we have a solution for that. We just didn't have it in time for the most recent weather events, for sure.
Totally. Are there conversations about kind of either kind of like changing some of these thresholds for activation of some of these resources, or, you know, we know when the hot months of the year are, we know when the cold months of the year are, like it's pretty obvious when it's going to be smoky for a long period of time. Like, can we just, you know, activate for longer periods of time? And I know there might be cost prohibitions there, but that seems like that would increase uptake a lot if those types of resources are available more consistently.
I mean, that was a huge conversation at the city council, for sure, about those arbitrary requirements, and like, oh, is it going to be the right temperature for the right number of days, and without dedicated places and dedicated staff, they're pretty hard, as Emily said, to, you know, sort of ramp up and ramp down. So that the center that we have now that is going to be permanent, that's a lot easier to manage, because you have a place, you know where it is, and you can make those adjustments as you go and people start to know where it is. I know there's a lot of conversation. I don't know if we're in the community at a place to eliminate those kinds of restrictions and just say for all winter, this will be open. You know, I haven't heard anybody working on that. We used to have winter sanctuary, and we don't have that anymore. So I don't know that I can give you a hopeful answer to that. Emily, I don't know if you have a hopeful answer. Probably not.
Yeah, no, I hear what you're saying. And I think that, and I will say that the restrictions have been lifted somewhat. So there's like the OES, like the Office of Emergency Services, and we never hit those, right? You have to have this temperature in 3 days and you can't get cooler than this. That's when like a response is mandated. most of the time that I'm talking about weather events, they're triggered by, you know, folks in my world and DHA saying it's gonna be really hot for a few days, let's extend. It's still not predictable because it's a resource thing, right? It really is. To mobilize a DHA bureau, you have to have security, you have to have staff there, you have to pay them overtime, and you have to get, you know, and it's a logistical thing. So I agree with you, like having more predictability. I would argue, you know, just having more year-round shelter versus, and I also wanted to say, because I think we need to start talking about this differently. The motel vouchers, I think, also come with a lot of benefits for the consumer, but they also come with a lot of challenges. I think there's this perception that like we're handing somebody a voucher and they're going off. It's not that. It's a warm handoff. Everybody has to have an ID. We have to manage the payment. There's only 6 motels who will take it. So I think there's sometimes frustration in the community that like we're holding these vouchers, but it's not that. It's because the mechanics of, we can find somebody who needs it, the mechanics of getting them approved by the motel in the vendor payment system, you know, so it's, and that's a reflection on, you know, capacity. As you can imagine, the motels who are willing and able to take that are pretty limited. So we probably need to start using a different term. But anyways, you know, again, not presenting a solution, but sort of acknowledging, yeah, it's a real gap and it's a challenge.
Yeah.
So I just want to say thank you so much. We're out of time, but this has been an amazing amount of information that we've gained from your presentations and insight. A lot of material to chew on, as well as Liz Gomez has put in the chat 3 of the plans, that the point in time count, the action plan for local homelessness, and the behavioral health services. So please check out those links there. I just am so appreciative of your time, Erin and Emily here. I have a feeling this conversation could go on a lot longer, and we may very shortly in the future ask you back for more updates. I'd love to see more numbers from the county on what you presented, Emily. It looks very interesting. I'd like to know the usage, the accessibility, and the progress over time. And certainly in these wonderful programs, the outreach programs, mobile units. And Erin, good luck with the center and and the upcoming opening of your 7-year effort. That would be, that's very exciting to see. So thank you again. And thank you, members, for attending, and see you next meeting.
Thank you for having us. Thank you so much.